I was competing in nationals out in Detroit, and it was the fourth event. The second to last event was a sandbag carry. It was a 300-pound sandbag. It was 80 feet down around a cone and back for time. And I was cruising, and just as I got maybe 40 feet from the finish line, I started to really feel my legs start to give, but I just had to cross the finish line. And as soon as I did, my legs just gave out, and the weight of the bag brought me forward. It happened like that, and I landed right on my elbow and ended up breaking it.
Steve's not the typical patient just in what his demand levels are. He's a very high demand individual. He lifts a lot of weight. He's a very big guy. So the things he wants to do are a little out of the realm of ordinary for other patients that I have. The actual injury he had is something that I actually see quite often in a whole different myriad of patients.
So I met with Dr. Paxton, and we just looked at the x-rays, and he gave me his opinion. Right away, I felt very, very comfortable. I really enjoyed his kind of general disposition and approach. So he said that I definitely needed surgery, that he was going to put in some hardware, that I wouldn't need a cast, which was great for me because I have a very physical job, and a cast would really inhibit me to continue to perform at practice.
So one of our jobs at University Orthopedics, and one of the things that we do as orthopedic surgeons, is to try and tailor the treatment to the patient depending on what they need. I could see his exact same injury in an older individual who may not need surgery, someone who's less high demand than he is or lower demand than he is, and treat it with a different type of construct, a different type of surgery. And so that's one of the fun aspects of what we do is, really trying to get down and individualize our treatment for him. And for him, I knew he really wanted to get back to lifting heavy weights, and I knew that he wanted to get back quick. He's a, pretty active person, and trying to slow him down is difficult, so I wanted to put something in his elbow to put it back together that would be very strong, durable, and allow for a quick recovery, which I think we were able to do.
I'm no stranger to injury. This isn't the first time I've broken a bone or hurt myself or had a setback. What I'm looking for is I want to get back to where I was before I hurt myself, or even in a better position. And he just had a very optimistic outlook on it. It just really put me at ease, I just felt really confident about it. So he got me in for surgery. I want to say it took around 2 hours, and I was out of the hospital, and I was genuinely pain-free. The surgery was Thursday, and I was pain-free come Sunday. I think there were 3 times where I had some questions, and within a day, within 24 hours, I got a phone call from Dr. Paxton, and he spoke to me. I'm also in contact with him and his staff through the portal, which for someone in my position is important. I just want to be in the know, and I want to do what's best to keep moving in the right direction. So having those facilities and those services available to me is important to do that.
Someone like Steven is, he's your ideal patient because he does what you're hoping that he does and what you know that he needs to do to recover. But he doesn't push it too far, and he listens to his body, and he's very in tune with his body, and in that way he's able to kind of take himself right to the edge, which is where you can get some of the best, recovering without being dangerous or irresponsible.
It's just a matter of just being patient and just taking your time throughout the process and making this a 6-month issue and not a lifetime issue.